So, guys, welcome back to the Burr podcast with me, your host, Owen Mallon, the Burr. But today I'm joined with Siobhan Cunningham, made all the way from Galway. Siobhan, thank you so much for coming up.
Thank you for having me.
And we're going to go through your life, your story. But before we do that, I like to get a bit of background, where you grew up, and how many brothers and sisters, and what was it like growing up in Galway?
I grew up in a small village called Kilcreast, which is near Loughrea, out of Galway. 5 in my family. I have a twin sister, 2 brothers and a sister. Grew up small village playing hurling, playing camogie. I grew up really, really fast, actually, unfortunately, because my mother was sick at a young age. So my mother had leukemia. So we grew up in kind of the cancer spotlight. My granny had died young as well. We had to grow up very fast, I think, at our age because of what we seen. There wasn't a lot of joy as a child because of that. So I think we had a hard enough upbringing, the 5 of us, because of the hand we were dealt with at a young age.
What age were you when your mum?
When my granny died first, and we were very close to our granny, so we would have been 14, 15. And then about a year after my granny died, my mother was diagnosed with leukemia. So it was really, we started out young having to fight for something. And I think that's one of the main reasons why I'm here today. Because even as my mother was in her 40s when she got diagnosed with leukemia, I could see back then that her voice wasn't really heard with being sick, especially being a woman. And I think between then and now, all that I've gone through, and a lot of stuff I shouldn't have gone through, is the reason why I am starting to tell my story.
Well, when did you? So you had? Were you the oldest in your family?
No, the second down. I have an older sister,
right?
And then myself and my twin sister are the second down. So.
And you have younger siblings?
2 younger brothers, yeah. So they would have been teenagers when my mother died.
What age were you when your mum passed away?
25. But she would have been sick when we were in our late teens. So she was sick for about 6 years.
So being one of the older girls, you would have been looking after the
boys, yeah. It's kind of a role you're put into without choice. And that's the way I feel about a lot of stuff about my life. It was a hand I was dealt with without choice. But I've always thrived on it. And a lot of people say, oh, you're so strong. But I wasn't given a choice. I don't think any of us that are put in those situations are given much of a choice. And I think that a lot of stuff we're not really heard and listened to. And I think that needs to change.
Yeah, because from talking to you previous, we're going to go on till the problems that you have faced and getting someone to listen to you. But when did you start having your own medical issue?
When I was a teenager, I used to get severe pain, the unbelievable amount of pain. I remember lying down on the floor at home as a 17, 18-year-old and in severe pain. And I didn't even know what it was. And I spent the next couple of years going in and out of doctors and just nothing was done. Eventually, I met a doctor in hospital gynecology and they said, you need to have keyhole surgery. And it was about 6 years after having really debilitating periods every single month. They did a laparoscopy and it was when I was diagnosed with severe stage 4 endometriosis.
Did you know that you suspected that you had endometriosis?
I didn't even know what it was. Even when they told me, I didn't even know. And even probably for months afterwards, I didn't know because back then it wasn't really known. This is 15, 16 years ago. You were told you had something. I was given an injection to help counteract. It's got to do with estrogen in the body and medication, pain relief. That's what I was given going out the door. And then one of the injections that given me, the reaction to it was horrific. It put me in a mini menopause and I had those symptoms for 13 weeks. Nothing could counteract those symptoms. You had to take the injection, hope for the best. And for the whole 13 weeks I had really debilitating symptoms. It was horrible.
What had anybody said to you what they thought it was before this?
Nothing, just a normal period or a heavy period or a bad period or just unlucky, really.
But you're in excruciating pain?
Every single month, yeah. It was horrible. I remember sitting down on the toilet floor for like an hour, just hoping and deep breathing, hoping that this pain would pass. And I think it was shocking when I look back my whole teens and my 20s having this debilitating pain and nobody doing anything for it or nobody listening to me, nobody answering. And even further on, as the years went on, I had a second laparoscopy. And during this procedure, I went in again for pain to help with my heavy periods pain and to try and give me back a better quality of life. And during this procedure, the doctor perforated my womb, and then he never got to do the procedure. And I remember waking up and I was absolutely devastated. Number one, because I had to stay in and I was a single mother and I was always worried about my son. And then the second one was there was no answers to what had happened. So then it was the next morning when I had come round fully and I knew what was going on. The doctor had approached me and the doctor had said to me that I perforated your womb and that I had to stay in for a couple of days. And I wasn't too devastated about that. I was more devastated that he didn't do the cauterization to clean out the endometriosis, that I knew I'd still be in pain leaving that because he couldn't proceed with anything because of perforating my womb. And then I said to him, what am I going to do? And he's like, oh, it's just a normal period, you'll be fine, take pain relief. And I was more devastated by that this came from a consultant gynecologist to say, it's just a normal period, you'll be fine. And I felt so annoyed by that more so than the perforated womb, because I just thought, come and live my life for the last 10 years of what I've had to deal with. And you can just say off the back of your hand that, oh, it's just a normal period. And that you signed the waiver for consent and you got your womb perforated and this is what happens. That's what you signed the consent for.
So, your condition's that bad, you've went for a second laparoscopy to the cauterized?
The cauterized, the endometriosis.
So effectively they're burning it off to stop the.
It's initially inflammation, isn't it, inside the body?
So they're doing that because the pain. Now, just for people watching here, and I'll allude to later why I had asked you to come on, because I had an understanding of the level of pain. Describe to somebody what that pain is like.
Well, I've given birth to a child. And this is severe than that. And it's every single month. So imagine giving birth to a child every single month. That's the only way I could describe it. And even the mental side of it, of trying to deal with it. You're sitting on the toilet, you're breathing, you're trying to get past it. It's really heavy periods, heavy clots. It's just insane. And then to try and explain that to somebody, unless a physician really, really understood it or experienced it, they hadn't a clue what it was. And I think that was the hardest battle again, to try and advocate for yourself and say, this is really affecting my life and there's no really solution for it.
The term endometriosis has only really now, I never heard of this before in my life. And the reason I was saying this to you earlier was when I had first met my partner, I remember on the second date, I looked around and there was like tears in her eyes, but just randomly, we're on a date and I was like, what have I done? I have fucked this up. And in seconds, she went to like excruciating agony. And I genuinely was like, am I driving you to the hospital? What is going on? And she's like, it'll pass. And I was like, and then all of a sudden afterwards, she was, and I was like, what? That's not right. That can't be right. And then she was like, I have a condition. And I was like, That's is mental to me, because you look like, she goes, it felt like hot pokers were burning her,
scraping the inside,
and then nothing. And I was like, this is fucking mad. And then the more now, obviously, then it's almost like when somebody says something to you, you become more aware of it. I think people have become more aware, because how many women would that have just been put off to say, oh, you just had a bad period? You know,
well, a lot of women wouldn't have even told somebody on their first date. They would have just asked to go home. So for you even to express that with you, I
think I had because I thought, I was like, genuinely, I know I'm laughing here, but this was somebody in excruciating agony. But I'm sort of being light of it because of the situation. I was like, I have fucked this up. I don't know what I have said somewhere along the line, and then I went away, and obviously, like everyone does, as soon as you hear a term, and when you hear that term, was it any sort of relief for you that now, oh, I'm not being mad, or it's not when I'm explaining to people now?
I knew what it was, but I expected a solution for it. I think that was the hardest part. You're after giving me a diagnosis, but what are you doing about it? There was nothing. There was no answers. There was medication.
But from you, I've got this. Like, this surgeon was like, well, you signed a waiver. That's it. Like a very dismissive attitude. They perforated your womb. Now, I know there's not a surgeon in the world would set off to do that, but Was there no sort of apologetic, we're going to get you rescheduled, we're going to get you back, I'm so sorry, look, this can't happen, we're going to get you back and we're going to do this and we're going to make this right? Was there none of that?
No, nothing. It was basically told it would heal, and I was given antibiotics as a precaution because of the perforation with an instrument. And no, because I ended up having to go back to the hospital twice after that. The third time I actually went to another hospital because I was in such pain afterwards. My stomach was really distended, really bloated. I had done this procedure before and I was back to work within a week. It took me months to come back from this. And I think that was the hardest part again, that this doctor had done this. Like, it can happen, but we need a solution for afterwards. And I was very much left on my own afterwards. I remember I was so sick that time, I couldn't get out of bed. And my son was putting on my socks and shoes. So this is my whole point of highlighting this. Like, you get maybe 10, 15 minutes in front of a doctor, but it's the family afterwards that has to pick up the pieces and stuff like that because of like misdiagnosis or lack of care or of lack of knowledge or not even listening. This is the whole point, that it's always somebody else that picks up the aftermath of it. Or I'm sure with your wife, you were there with her a lot of the months, getting her through it and things like that.
But it's to me, it's almost like malpractice. Like, if that was me, like, and I understand. So look, listen, we always assume doctors know best, and we have learnt a lot in the show from all the people we've talked till, that it's like everything. There's good and there's bad, and there's people that are like, shouldn't be in certain professions, no matter they are or they're not. And you think when you go to that level of professionalism that these are the right people and they know what they're doing, but they have done that, made that mistake. You were there with the sole intention of, please relieve this pain of me. They have just made it worse, reminded you that they're not responsible for it, and sent you off till just on your way.
Yeah, I think that's... I've never really spoke about it into that, because since then I've been fighting to come back because other things came about. But then when you say it, there's an awful lot of sadness in having to live that way for so long. And I think we're all here for a short time, and we all deserve to be looked after correctly and properly. And I think so many women have to fight their way back from certain things so too often. And I get sad even thinking about it now, because I suffered for 16 years since I started my period, and no end solution for it. And I think that's the hardest part for it. And there's so many women. I'm on so many groups, and there's so many women in the same position as me. And there is a bit of comfort in that, knowing that you're not alone, but it's still not nice. I've asked for a hysterectomy now because I'm done. I'm done with it. And even when I went up to Dublin for the consultation, they said they're kind of, because of my age, it's not given to you straight away. Even though I have suffered for 15 years of pain and tremendous periods, they're still questioning you on what you've decided to do. They make sure this is the right thing for you. But you've come up with no other solution for me, so I have no choice but to do this, because I can't take this anymore. I can't take the pain. And even for that, there's loads of meetings, and they want to make sure they're doing the right thing. And then to try more medication. I have tried nearly all the medications they've given me, and every single medication has had a severe side effect. And then you're sent home to deal with those side effects as well. And I'm done. To even tell a doctor that you're done and get a doctor to really listen, I am done. I want a hysterectomy, because there's no other solution for what I'm going through.
What age are you, Siobhan?
I'm 38 years of age.
Like,
I wanted more children at the time, but now I'm done. I'm done with the pain. I've come to a stage now, after all that I've been through, that I'm done. I have a little boy. He's amazing. I would have loved to have given him a brother or sister, but now I can't.
Well, surely when you're arriving to the doctors, and surely when you're arriving to a doctor and you say to them, I want a hysterectomy, and I'm 38, because nobody wants to be making that decision.
They told me people at my age usually only get it done if they've cancer.
Surely they see the desperation in the pain and the quality of life, and this is what this pod is about the quality of life, and getting people to listen and understand. Like, you how they're not listening. You're in that much pain, your quality of life. How was that affecting your mental health as well as your physical health? Because if this is coming every month and you're like, shit, something's coming up, and now I don't know what way I'm going to be, or am I going to be fit to get out of bed, or am I going to be fit to get off the floor? What way was that in the midst of that?
Well, at the start, it was devastating, but then I think we learned to live with a lot of things, and it was just the norm for me. And I just knew it was coming. I'd have to accept it. I knew I'd be in tremendous pain, but I knew I had to get through it as well, and I knew I had to keep getting up. I wanted to stay in bed. I didn't want to get out. I wanted to get through the couple of days and be done with it. But I had a son. It goes back to that again. He had to get up for school. He had to do his sports, do what he needed to do. Horrible experience.
Sometimes, now I might be wrong on this, so I'm not saying this as always, because I wouldn't want to say this and someone that is suffering from endo thinking that this would be sometimes, because I know this is the turning point for what my wife was when having children. Sometimes they say that it can help with the symptoms.
After my son, it did. For a few years, I had a bit of ease. I really did. And I remember when I was told I was pregnant, I fell off the chair because I was told a 4% chance of having a child when you have this condition, because I had stage 4 severe endometriosis. And I remember the doctor saying, you might not get a chance. And the first consultant was really kind. He was he ended up retiring about a year after I was diagnosed. But I remember he said, you've about 4% chance, you've severe, it's fairly severe. But within 2 months of actually having this laparoscopy, I found out I was pregnant. And I remember thinking, oh my God, this is shocking at the time, because I was really nervous. And I was young that time. I was 26 when I found out I was pregnant. And I was really scared. And I had a really, really bad pregnancy because of it. I was so sick, hyperemesis I got the whole way through it. Shocking. But to have that now and knowing that I had my son, I think it's an absolute miracle, considering women with endometriosis are told they can't.
It is massive. And being told a percentage like that, and sometimes you wonder how they work this out, but being told that there, like, that's devastating in its own mind. Not at 20 years where you're not planning it, but, and I don't know whether I can say this, but sometimes I think it's worse that that's for women, because men don't think in them terms when they're younger. But being a young woman told that there's a limited chance of having a child, it's bound to be so, like, there's more and more being taken away from you. Do you know what I mean? If that makes sense? And I don't want to say that because it's hard for me to, like, people will be like, this podcast, and here I am sitting here asking you questions, we're discussing periods and things, and I'm like, but yeah, I might be uncomfortable, but I've had to get comfortable, and people are going to have to be like, you need to be more adult and growing up, that you're having this conversation with your partner, your wife, you're understanding
100%.
the exact. So
but even my son is 9 now. He has seen me in tremendous pain. He knows what it's about. He calls them, what does he call them? Women problems. And I just think even for him, the pathway to adulthood and respecting women, I think that's outstanding for him to be aware of that. And he knows now, can I get you something, or hot water bottle and things like that. And he's 9 years of age. He mightn't like it when he's 16 years of age, and he might stay quiet about it. But I think it's really good to know at a young age what it's like for women, what it's like for a lot of women.
But there will be a lot of partners out there that their wife or partner or girlfriend's going through this.
Yeah.
And it also can obviously play an effect on intimacy, because you're in pain. What's the last thing's going to be in your mind? But not understanding that, not knowing, like, they're thinking that they're maybe being rejected, when you calm yourself down, somebody's in absolute agony.
Agony, yeah.
And like, this is what I was saying, that, sometimes we have conversations here and pods here, and I'm like, even know that you might not be completely know that there's 50 other people that are like that in a relationship, but they're not actually asking the partner. They're maybe hearing it here. So,
well, my mother went through it as well. Even though she had 5 kids, she had a hysterectomy at 34. And back then, my mother was 50 when she died. She died 11 years ago. So we're talking about 30 years ago. My mother would have gone through, imagine that time, 30 years ago. It was straight away a hysterectomy. And then she had to deal with the psychological side of that. And then afterwards, to be told she had leukemia. So it goes back a long time.
Siobhan, you've passed over so many things like that. You've experienced so much hardship, and I know that's because you've known no different. what you have to deal with. But each of these things themselves, like even that pregnancy, like I've known ones that have what do you call it?
Hyperemesis.
Hyperemesis.
So,
That's the same thing that the princess, what do you call her, had, wasn't it, when she was really ill?
Well, I know it's highlighted because she's in that. She's a higher level, or what would you say?
It sometimes does help when a high profile person experiences something, because then people can say, well, this is what this was, and you now understand why. But the reason I'm saying this is I know one, and their pregnancy was like, they're like, we're having one child. That was brutal on its own, let alone
I didn't enjoy my pregnancy at all. I didn't. It was honestly horrible. Just the symptoms on top of what I already was dealing with. But then once he was born, I didn't care. I said, get me to the end. And once I got there, I was happy. And I remember when he was born, I promised him, because I knew at this stage I had had a really hard couple of years. And I promised him as long as he stayed with me, we'd do the best we could. And I'd love him unconditionally. And I've kept up that promises. And I think he's got me through a lot more than he'll ever realise. A lot of things that both of us have been handed, we didn't deserve, but we've got each other through it. And I think we've a unique bond, the two of us.
That's lovely. That is, but that is the miracle we talk about.
And that's why I'm here again today, because so many things that when you sit in front of a consultant, as my story went on, I ended up sitting in front of a cardiologist who kept misdiagnosing me. And she failed to recognise that I was going home to a little boy that needed me. There was no one else there. And I think this is the biggest thing that I'm trying to highlight, is that listen when I'm telling you there's something wrong, and believe me, believe what I'm saying. I don't want to be sitting in front of any of those doctors. I want to be at home with my son, living my life. I don't know anyone that's been sick wants to be sick and in front of a doctor. I don't believe anyone wants to be there. But when you're there, you've got 8 to 10 minutes to put your story to a doctor. And it comes to me at this stage, they either believe you or they don't. And so many things have gone wrong. Like even my son, he had a tonsillectomy at 4 years of age. I had to beg for him to get it because he really suffered with his tonsils. And then he got his tonsils out, and 2 weeks later, he was really quiet this day. And he'd just come back to school, because when you get a tonsillectomy, it's 2 weeks, and then they say you're in the clear. And he was really quiet that day. And even in school, the school had said that, it was a preschool, had said that Callum wasn't himself and he's complaining of a pain in his tummy. So I brought him to our GP at the time, and she said he's fine, there's nothing wrong with him. And then about 4 hours later, my twin sister brought me and my son to the out of hours doc. And I went into another male doctor. And at this stage, my son had a little stream of blood coming out of his mouth. And I had said to the doctor, there's something not right with him. And then he said maybe he clipped himself in the waiting room. That's why there was a stream of blood coming out of his mouth. And I begged him. Callum was really agitated at this point. And I had said to the doctor, please, he's not himself. I know him. He's not himself. And then the doctor had said to me, it's 2 weeks post-tonsillectomy. There's nothing wrong with him. He's fine. And he had said then at that point that I was over-mothering and that my child was fine. And he sent us home. And about 3 hours later, my son was in the back of an ambulance. He started puking, but I didn't know until I turned on the light that the bed was covered in blood clots. The whole bed was covered in blood. And then as I stood him up, the whole hall, he kept projectile vomiting, but it was all blood. And luckily, when the ambulance was called, the ambulance was there in 3 minutes. And I remember that when the paramedic came in, he said, Siobhan, we got to go. He wouldn't even let me put my shoes on. He just grabbed, but he took pictures because he wanted to show them in Galway the extent of how bad my son was bleeding. And in the whole way in, my son was so quiet. I remember holding him in my arms in the ambulance, and he was so quiet. My son is really bubbly, and he never spoke. And he kept projectile vomiting all over me. By the time I got to the hospital, I was covered in blood here. And when we got there was an Indian doctor. All I remember was seeing his eyes, and he made me sign a waiver, and he said, we'll do our best. And I remember sitting outside the door for 4 hours waiting for him to come back, and people were staring at me because I was covered in blood. And I remember saying, please just bring him back to me. And at this point, I didn't think he was going to come back to me because I had so many things gone wrong for me, like my mother, my granny, everything had gone to death, and I was convinced they were going to come out and tell me he died. But thankfully, when they did come out, he got a blood transfusion, and it took a while for him to get back. out of that. But if that doctor had just thought maybe there's a 5% chance that he could have had a bleed after 2 weeks, just because it was two weeks past it, he didn't believe that what I had said, that he's not himself, there's something wrong. But if he thought there's a 5% chance that this could go wrong and send him in instead of sending us home, we wouldn't have had to have gone through that trauma. The result was still there. He was obviously still bleeding at the time. But imagine just believing a mother at that point and not saying she's over mother and sending us into Galway as opposed to sending us home. Maybe I wouldn't have had to have gone through the trauma of that.
Do you see the doctor that they've said that? And I believe this so much. A mother knows there is something they're innate in that they know their children, like if there's something not right. My wife could turn around and say, he's not being himself today, and then later on that night his temp goes up or something. There's just something about this. Do you think you're standing there and you're such a pleasant person, and when we're talking and you've silently spoken, do you think that they're brushing you off? They're thinking you're, what is it like? What?
I don't know what it is. Maybe, I don't know. Now I'm going forward, I fully believe a lot of things that happened to me was because I was a single mother. I think there's a thing about it. I think I don't know why. I think we're put in a bracket that it wasn't a bracket I wanted to be put in. And why should I be punished or have to live a different life because I stood up and his dad didn't? I fully believe that there is a thing about women, and there's also a thing about being a single mother. I think if there was a man sitting beside me in that doctor's room, it could have gone very different, because the doctor wouldn't have called me an overmother, because
I know this because, and I'm telling you this here now, I have been in a scenario where I've been sitting and I'm like, no, my wife's trying to be the nice person and the thing, and I don't mind being that person at that point, being aggressively or disagreeing with the doctor, and have when our second boy was to be delivered, I remember sitting there going, no, we'll wait. And the whole room, I didn't care what way they looked at me, and my wife was, I knew she was nervous, and I was picking up that she was nervous, and I was like, no, we'll wait, the specialists come. But I just don't understand, like, see that doctor, does anyone make him aware that you ballsed up earlier? Does he know then that Callum nearly died?
This is the thing. That happened 5 years ago. 3 months ago, the outer hours doc again, Callum, I can't even remember what happened to him, but I had to bring him to the out of hours doc, and you don't know who you're bringing him to. And I hadn't seen this man since then. And the doctor opened the door, and it was him. And I hadn't seen him since that day. And I went really quiet and I froze. And he probably thought, what the hell is wrong with this one? So then we went into the room and I sat down. I couldn't speak to him because it literally brought me straight back to what happened. And then do you know what I learned from that very moment? And he didn't know who I was. Didn't know. He didn't remember. He actually, when I said it to him, he challenged me on it. He actually said, oh, I would never have sent a child home in that scenario. And I said, well, you did, because we went home, we didn't go to the hospital. But he didn't remember us. And that's when I learned that, like, the impact of being in a doctor, you are a number, you're a person. They do the best they can most of the time, but then you're gone, and that's it. He didn't remember the impact that he had done to me and my son. And that's what really, really hurt me. I ended up staying. He looked at my son and I went out the door, but I took him to another doctor because of the fact that I had absolutely no faith in this man. But the shocking thing for me was he didn't even know what we went through. Not a thing.
Where's the level of accountability here? Because if that was any other profession, somebody's going back and saying to them, you've done this, you've done that. He doesn't remember you, and you near lost your son. One of the most traumatic things that ever happened.
And that's another reason why I speak up now and I try and advocate, because at the end of the day, that time I was just glad he was alive and he survived it. Because a week after that happened to my son, my best friend actually committed suicide. So I had to deal with trauma after trauma. And at the time, it wasn't about making a doctor accountable for anything. I had to survive another thing with my best friend. And my best friend brought my son into the theatre the first time. And I was so nervous because I didn't want to see him be knocked out. And I remember my friend saying, when you put the little jacket on going into the surgery, she said, you're going painting. because my son was allergic to penicillin, to wear a red hat on him. So she had told Callum that he was going in painting. And I was like, that's brilliant. That was a brilliant thing to say to him. And then a week later, she commits suicide. And that was another trauma again. And she had her own mental health issues that I don't believe were heard and seen, considering what she had gone through herself. And it's just, there was no one accountable for that either. I just think too many things happen that shouldn't happen for an extra few minutes of listening to what I'm saying and taking it in and believing me. I just don't know. I just think too many things have happened to me. I'm 38 years of age. I've gone through more than what most people go through in a lifetime. And I just don't think it should be the way it is.
It's incredible to listen to all the things that you've had to endure. And I do believe more and more as we're talking, Callum, really is a miracle in your life, that you know, that constant love there, while everything else around you is exploding. I can't begin to that 4-hour wait, that level of fear. I know every parent's worst fear and nightmare, but until you're the other person in that door, and I never ever want to even, and sometimes I find very, very hard till I try to empathize and put myself in that position. But sometimes when people talk about these things, I actually see me actively don't try and be that person at the door, because you're going to start welling up and you're going to not articulate anything you want to say.
And imagine being a single parent and having to live like with that, and knowing that if something does happen to me, there's no one else is going to love that child the way I love them. And I think that burden in itself, trying to get well and advocate for yourself going forward, was a really, really hard thing for me to do. After I got the perforated womb, I never fully healed after that. And then about 9 months later, I woke up in the middle of the night and my heart was pounding. My heart was absolutely pounding. And I didn't even know what was going on, because at the time I had no concept of my heart. I didn't think of my heart. None of us do unless something happens. And I let it off that time because my heart rate came back down and I went to sleep. Then the next day it went off again, and I had a Fitbit on and my heart was doing 180 beats per minute, and I felt really unwell at the time. And I ended up phoning an ambulance because my heart wasn't going back down. And I ended up going into the hospital, and at this time I had to bring my son in with me because it was in the middle of the night that it happened. And I was really scared because I thought, what is going on? What is going on with my heart? And then when I went in, the first question was, who lives at home with you? Who's your help? Have you any more kids? And it goes back to like, they're judging me before anything by who's at home. So anymore, I say, well, does that help in you diagnosing me, knowing who's at home with me? And I think that was the biggest thing I learned from what I went through as well. But they kept asking me, do you take cocaine? Do you drink a lot of coffee? They were trying to come up with the daftest things from what I could see about why my heart rate was going up so high. And they did agree my heart rate was high. It was like 130 beats per minute at rest. And normal fit person, 60 to 80 to 100 beats per minute is the norm. And mine was 130. So I was sent home with a medication, a beta blocker, to bring down my heart rate. It was agreed that it was high, but it was most likely from stress, from what I had gone through with a perforated womb and basically being a single mother.
Did they do blood tests? Or
at that time,
or anything like that?
No, because by the time I got to the hospital, my heart rate had kind of gone down into a normal rhythm, but it was still high. So they gave me the beta blockers and sent me home. They put me on a really high dose of beta blockers. And again, when you're taking these tablets, I had already low blood pressure. These gave me lower blood pressure. And I felt worse on them than I did without them. And I kept presenting back into the hospital with the same symptoms. And then I was getting sicker and sicker. And I kept asking, why am I getting sicker? Even when I was going up the stairs, I was breathless. I couldn't walk from my toilet to the bed, and I was breathless. And I was getting sicker and sicker. And every time I presented to hospital, it was, there's nothing, we can see nothing, there's nothing showing up. And then I got an echogram, nothing showed up on that. Then I had a really bad couple of weeks, and I went up the stairs one day and my heart was racing. By the time I got to the top of the stairs, I collapsed. And my son came upstairs and he had to phone an ambulance for me. And again, I was brought back into the hospital in an ambulance. And again, nothing was done. I remember sitting in the room and they kept asking me, do I drink much water? As if water was the holy grail, that it was going to cure me. So I remember being so annoyed at that point. It took me half an hour, breathlessness, tiredness. I walked all the way down to the canteen, and I remember buying as much water as I could fill in a bag to bring upstairs. And I remember leaving it on the tray in the room, because I said the next time they come in, they're not going to ask me to drink water. Something daft as that. And there was still no solution for what was gone. I first went into hospital in July with symptoms with my heart. And the following May, I was back in hospital again. I was there for 4 days. I was offered to do a cardiac MRI and a stress test and a loop recorder. And by the time they had gone back and consulted with my original cardiologist, nothing was done. And I was actually sent home again. And it was a year later, at this stage, I had really deteriorated. I wasn't getting out of bed. I was literally living in the bed because I had gone so breathless, so fatigued. I couldn't even stand up. My heart was bouncing. My heart I could be sitting down watching TV and my heart rate could go up to 240 beats a minute. That was the highest they had seen it. And I knew that I was in trouble because I was as pale as a ghost. I wasn't eating. I wasn't sleeping. My body was so weak. And I think that was the hardest part for me, was every time I went into hospital, I was fully convinced I was one conversation away from being sectioned, because they kept telling me I was anxious and that I was a single mother. All the traumas that I'd been through in my life, I told them about it. And it was like they were questioning whether I could cope with those traumas or not. And that was the reason why they kept putting me down to having anxiety and panic attacks. So when I went into hospital, the first thing that came up in my file was panic attacks, anxiety. And I was like, how am I going to convince these people that I'm not mad? I'm not mad in the head. There's something seriously wrong with me. And then one of my last times in the hospital, it was said to me that, look, we are going to send you somewhere else for testing, but we're not convinced there's anything wrong. And it looks like that you're going to need a psych evaluation afterwards. And one of my last letters from that cardiologist at the time was, there is nothing wrong with your heart. If you sort out your physical symptoms, your mental, your physical symptoms will disappear. I believe there's nothing wrong with you. And I kept collapsing. And I just thought, I'm going to die. I'm honestly going to die before they find out what's wrong with me. And it was by chance then I was sent to Dublin. And I got an external heart monitor on for a month, the ones they stick on. Yeah. And I actually had the worst month while I had that on. And I was actually so thankful I did, because it was the only way they actually picked up everything that was happening. So they picked up my heart rate was extremely high. It was going into SVT, which is a really hard rhythm. And then it picked up that there was irregular beats coming from the bottom node. So you need them to come from the top for your heart to be healthy, but they were coming from the bottom. So they knew then there was something wrong. So they sent me to Cry Ireland. And that is the sudden death. And my cousin had died suddenly the year before. So then again, it was like, this is scary. They're sending me to the sudden death place. But it turns out that they gave me, the minute they seen me and my symptoms, they sent me for cardiac MRI. And this was offered to me a year and a half ago, but then it was refused because I didn't need it. And from that cardiac MRI, they found out I had scarring of the heart. And then they found out from that, I got diagnosed with myocarditis. And even to know that was what was wrong with me, I didn't care what they diagnosed me with. I just wanted to know what was wrong. And then I got the loop recorder implanted in my chest so they could tell every single heartbeat. And then I didn't have to go through of trying to figure out. They told me to buy a Cardiac Live app. This is what they advised me in Galway. And that you had to basically diagnose yourself. They needed me to catch my episodes as they went along. So I went to the stage of setting my alarm every hour going to bed, so I could hopefully catch the episode as it went on, so I could hopefully diagnose myself to tell them in the hospital, this is what's wrong with me. And I believe that I wouldn't have been bedbound for a year and a half if they had listened to me at the start, because they told me that in Dublin, if I was given an anti-inflammatory medication for the heart for 6 months, it possibly would have intervened and I wouldn't have been bedbound. And then I got diagnosed with, on top of that, with POTS syndrome. Because I was bedbound for so long, my autonomic system just went. And then I had to do a rehabilitation program to get myself back out of bed to start living my life the way I should have again. So I lost 3 years. 3 years because the doctor wouldn't listen to me again. Believe me. Just believe what I was saying. And that, for me, was the hardest part. And I can't have hate for that doctor, and I can't feel sorry for myself, because that's not a place anyone needs to go to. But what I can do now is try and change the opinions of doctors, change people like myself that go in and advocate for themselves, that if you sit in front of a doctor and you fully believe there's something wrong with you, advocate for yourself. Go to have a second opinion, have a third opinion. Because at the end of the day, you're going home and you're living how you're living, and that doctor hasn't a clue how you're living at home. And I think that's the biggest message, is advocate for yourself. And get a second or third opinion if you need to. And I think that's one thing that I'm going to take from here anymore, that if I sit in front of a doctor and I fully believe that there's something wrong with me, I'm going to get a second opinion. And I think the trust in doctors is gone with me now. It's gone. How can I have any trust in them after what they did to my son, what they've done to me? And then no accountability. Not one person has said to me that's hurt me in that way, said, I'm sorry, I'm really sorry, I wish I listened to you. A few cardiologists have stood up and in meetings that I've been involved in, and they've apologised on behalf of their colleagues.
Because they're embarrassed.
Yeah. Like, and if I remember the man stood up, and I said to him, I said, you don't need to apologise for somebody's behaviour, but maybe educate them into listening to people. But I don't believe I would have gone through half of what I went through if I wasn't a single mother, if I wasn't a female maybe as well. But like in Ireland at the minute, what do you think is the biggest cause of death in Ireland? It's cardiovascular health. There's 1 in 4 women die every day, and we present with very much different symptoms to men. And that is crazy, because I grew up with cancer. My granny died, my mum died, and I never thought I was going to be sidelined with a cardiac condition. And then once you know these things, it's quite frightening that none of us really know what's coming to our door. Like, none of us know when we're going to go down and what's going to be the reason why we go down. But for me, going forward, even to educate myself on the heart and eating well and moving the body. But for me, like, cardiovascular is very not talked about in Ireland. It's really not. Like, 1 in 4 people die from cardiovascular, and women. When I went to the cardiology ward, every time I went in, it was always men. I was the only female there. I was the only young person there as well, but it was all men. And I went home thinking, oh, women aren't in there because women are healthier than men. But it turns out that women don't get that far because they're not listened to. 2 weeks ago, I was down in Cork with my son, and I spoke to a man on the bus. I'm really chatty, I'll talk to anyone. But I think even by chatting to people, you're telling your story as well. But he presented with the exact same symptoms as me with the cardiologist, and he got diagnosed within 3 days of myocarditis. 3 days. So why did he get diagnosed within 3 days, and I had to get diagnosed with 3 years?
It actually, the more that went on, the angrier I could feel myself. And you're such a better person than me, because I'm not getting that from you. I'm getting from you that you want the change, and you're advocating for, for women to be heard. And, this is something that us as men can help with in the mindset, as in that old school doctors. Like, I was getting angry there. And I was like, how can these people do this? Like, how can they be so dismissive? But their impact on your life, it's so minimal to them. They're like, one doctor didn't remember you. This cardiologist is sending you a letter saying that he basically, in a very polite way, he thinks you're away in the fucking head.
Yeah.
And you could have died if you continued in his care.
But even if I did have mental health issues, that this doctor, she didn't refer me on to anyone else. She didn't put me on to somebody else. Even if she was convinced of that, there was still no help for that either, even though she was completely wrong.
And so it was a female consultant.
Yeah.
And I wonder sometimes at this, and people might think that I'm. Sometimes do you think that a female consultant that have made their way in that hard line world are nearly every bit as bad as men at listening to women?
It came up about a year ago about it being a female, but they said then because she was in an environment where there's all men. If you see in Ireland, there's 90% male cardiologists. There's 10% women. But that's not for me to question. Or I went in to be diagnosed. I didn't care who was in front of me. Yeah. I just wanted whoever was in front of me to diagnose me. I did eventually get diagnosed by a female cardiologist in Dublin. But in the field, you'd like to think that because women go through what they go through, they'd be more sympathetic or more empathetic. But it's all got to do with who you're sitting in front of.
I think sometimes they harden in them surroundings because they're fighting again men to compete in them high successful jobs.
Yeah.
That sometimes they become slightly hardened and slightly, I might be out of line in saying this, but slightly harder on women because they're like, you don't know what I had to do to get here, and
Yeah.
slightly
That's funny you say that. Well,
conceited.
it's not funny you say it, but it did come up, that whole scenario you said. But for me, at the time when it was said to me, I was a little bit angry and I didn't really care what the person had to say. But it could very well be. There is only 10% female cardiologists in Ireland, so maybe they've had to fight for their spot more than, but that didn't do a patient any good.
No, and ultimately, here's where we're at. We have had several mispractice, several people have let you down. I don't believe anyone ever in them positions set out to do this, but after a period of time, maybe the way they go about it, they need to sit back and say, you know, yes, I understand that if they're under pressure or they're under thing, but the severe impact that they've made on your life by not, if they treated everyone as they were talking to them. Now, I don't know, like we're going to have people saying, oh, it's overstretched and it's underfunded. Yes, right, okay. But then please deal with the people that you can see, right? That you're not sending your son away. I seen the pictures and it's horrific.
With the blood, yeah.
If you want, we can use and show people. The fear, when I seen them, it looked like a murder scene. Like, that was absolutely awful. You won't give people enough time. You're not listening to what they're saying. And look at what's happening at every point when you went to someone. You've went with your endo. You're lying on the floor. Nobody's doing it. You've got a perforated womb. There's not a sorry. There's not an accountability. There's not, okay, we're going to put this right. There's like, here's a tablet. Away you go. And this tablet scenario, this pharma all plays into another thing. This plays into money, corruption and power. Like giving people tablets to send them home for things that they were doing. Then your heart...
I was put on antipsychotic medication for 3 months while I was being investigated for the cardiologist. Because and I did take it because a part of me thought maybe they are right. There's a small part of me that maybe thinks they are right, and I took it. And the only reason I took this medication was because I wanted to feel better, and I thought by taking it, it would do it. But it actually made my symptoms worse. By taking medications like that, when it can actually affect the electrical side of the heart, so it actually pissed off my heart more.
It was kind of productive.
Yeah. And then I presented back in again, so they gave me another medication, like a Valium, to get me used to the medication, get me over the hump of it. And I literally took it because what else could I do? I literally thought if I took this medication, it might heal me, it might do it. But at the end of the day, I shouldn't have had to go through what I went through.
That is mental. Who would have prescribed you and Auntie that doctor?
Well, when you go into my file, not now because I made them change it, but when you opened up my file, if I went to a hospital 2 hours away from my house, when you opened up my file, the top of the list was panic attacks. The second was anxiety. And I had asked the next cardiologist that I went to, get that off my file. I don't want that to be used when I go to another hospital as a reason why
That's
I'm
presenting
here.
you as a complete different. And now, I need to be completely honest. The stuff you've endured, the things you've gone through, somebody could have at a point says, you know what, this has got to have taken a devastating effect, mentally, physically. But you knew, and you're presenting and saying to them, you're not presenting other symptoms of these, and they're dismissing you. And it's almost like panic attack. It's her head. She's you know, if you were reading that, and you're going to another doctor now, and while a doctor's not give you enough time to actually figure this out and put this on your file, when you're presenting to another doctor, they're getting a blank canvas and they're looking, and then they're seeing these notes from previous ones. We put her on antipsychotic medication, we put her on Valium, we think that it's in her head. It's the note you'd have got out would have been in your file.
Yeah.
They're then treating you the same way that you've been treated
100%.
by everyone else.
But I've requested those notes to be taken off my file. You have to give
But you're
proof of
having
ID.
to fight.
Yeah, you had to do that again. And you can't just pick up the phone and say, get them off my file. It has to be put to a board. You have to give a reason why you want these off. It was 3 months ago I went to another hospital. I actually did the Camino in Spain. And when I went in, I had a sore leg, and the man ended up keeping me for 4 days. And he knew by my notes that something had gone wrong. I had said nothing to him about being misdiagnosed, but he knew from the first notes to the last notes and to seeing my cardiac MRI. He knew. I kind of said to him, I don't want to get into it. And he said, there's one thing I'll tell you. He said, you have humane doctors and you have inhumane doctors. And he goes, that's the way it is across the board. And he was so kind. He ended up keeping me in for 4 days. He did every test possible. And then I thought, maybe I'm over advocating for myself. They're doing everything. But he still listened to the symptoms I had and done what he had to do. And
let them over the top all the time. If they're over the top in every scenario that you presented, Callum wouldn't have been rushed to hospital that night. You wouldn't have had a year and a half in the bed. This is the thing. What's the worst outcome in being thorough? What's the worst thing? They're jumping to preconceived ideas. And you're right. What does it matter? Your marital status, your history, yes, your family history. So losing your mother and your granny, that could play into your medical, because if this is presenting symptoms of what's in the family, and that could. But what has the other things got to do with the physical well-being of you? And at the start when you were like, I don't feel like I was being heard because I was a woman. There's not that I was dismissing that, but I was like, why? As we started going on, but I am firmly in belief that you're right. And the other side of that is you're a pleasant, and what you've had to cope with, and what you've had to, and I would say you find it hard to be ignorant or find it hard to be abrasive with these people. I would literally say, I'm not fucking moving till you sort this out. But that's okay, because
I'm gone like that now to a certain degree, because I did counselling. I did 3 years, but then it's like I won't tell any of the doctors I did this, because then that'll be used again. But why can't you have anxiety or mental health and a cardiac condition and endometriosis? And I knew I struggled with the trauma. I got counselling for 3 years, and I love saying it, because I think everyone should get counselling. I don't think anyone is immune to it, but I got it because I knew I was struggling with the fact that I had so much trauma. And if I didn't deal with this trauma, where was I going then? But for me, I knew I was struggling. This was before my heart issues. And because of that, I went and got the help I needed for 3 years. And I knew that I was really, really good in the head. And I'm really good in the head now. But I did struggle. But I struggled because of the look what I've been through. And I'm human at the end of the day. And I think, why can't you say you had anxiety before, or you had trauma before, and then have that, and then if you have to have something else, have something else. But I just think it shouldn't. There used to be a big taboo years ago. You wouldn't tell your neighbour, or you wouldn't tell your mother you were going through counselling, because it was such a taboo. You certainly wouldn't talk about periods a couple of years ago. You wouldn't talk about, there's a lot of things. But I don't think, what's going to change if we don't start talking? Nothing is going to change. And I'm not trying to change the whole of Ireland with women and all these kind of things, but if I can help one other person, which I know I've done, I've been contacted by many people. Even last weekend I was out for my first night out in 3 years, and I was really nervous. And people don't understand that when you've been through all that and you've been bedbound, and then you start coming out into the world, it's very scary, because number one, you're wondering, are you going to collapse again on the side of the road? Are you going to collapse without people around you? And then there's a fear of being the breathlessness and the tiredness. Like, it's a total different ballgame that people don't really understand. Some will by listening to the podcast because they've been there, but others won't understand the value of going for a walk in the fresh air after being in bed for a year and a half. But for now, when I went out, I sat beside a man, and I had said to him, this is my first night out in 3 years. And he said, oh, what happened? And I just explained very briefly. And he turned around, and by me being open to him, he told me, like, he got a really shitty diagnosis 2 days previous, and this man started crying. And I thought, oh my God, this is my first night out. But then I sat away from it, and I thought, I gave him the advice I would have given myself 3 years ago. And before he left, he came and found me, and he gave me a big hug. And I had said to him, I said, on your darkest day, if you feel like no one's listening to you and people don't get it, I said, you find me, you find a way to find me and you contact me. And he's like, he couldn't believe it. He couldn't believe this was brilliant to him, because I do find when you being sick, you can tell your friends and family what you're going through, but they don't necessarily understand. So when I joined Cry Ireland and Cree, and they're the heart charities, you're really in with the people that you need to be in with. And then you don't feel like a burden as well, because you're in talking to people. And when I joined Cree in Galway with Annie Costello, she was just fabulous. And she linked me in with a heart-to-heart women's event. And I got to sit and talk for the first time and be really heard about my conditions. And women stood up and applauded me when I spoke. And I was like embarrassed. And I thought, so many people came up to me and they were like, you're so brave for telling your story. But again, I felt like I had to tell my story because I was silenced for so long and I had to be quiet. And like, I didn't dare ask a consultant anything or argue with the fact that they were right and I was wrong or whatever. But now I would absolutely challenge the fact of that. But going back to the man I met on the night out, was that he took so much away from me talking to him, because I had lived experience of having a bad diagnosis. And I really hope he does really well. But even from that, he said that, like, you can get annoyed with your family when you're sick. I found out a lot that my family come and visit me and they'd stay with me and they could say, oh, you're tired again. But for me, I was absolutely exhausted from living with my condition, having to advocate for myself and trying to live. I was single at the time, and I was quite happy being single, because I honestly don't think I could have dealt with a relationship on top of trying to be well and trying to live my life well. And even when I was very sick, trying to mind my son, I felt really guilty that I wasn't able to do what I could do with him before. And then you overcompensate. So then I'm left with, am I spoiling him? Am I doing too much with him? There's so much more of a bigger picture than sitting in front of a doctor and being misdiagnosed. The aftermath is massive afterwards. It's really, really massive.
I find it so hard that you had to actually try and mask the fact that you had went and spoke to someone for the worry that might implicate your physical symptoms. Like, you're nearly actively trying to disguise the fact that you're talking to someone when you should have talked to someone. And like we've spoken on this podcast a lot about, we have massive helps for advocates for people to seek counselling and different types of counselling. Some people relate differently to others, but all that you've had the process. But the fact is that you are physically ill and you're worried. Like, you shouldn't be worried. You should be fit to go and say, look, listen, it's not my head, because I've been talking to someone. I'm not where I want to be, or I'm not where I'm in the process of getting where I want to be, or I'm working on myself at the minute, but that's not what's happening. But it almost seems like at every one of these points, they just didn't listen.
No.
And is it the squeaky wheel gets oiled first? Is it the loud one? Is it the loud one in there? Is it what is it with these people that as you say, the impact on your life? See me, I was so, like, you're such and I really do think you're going to help so many people. There's going to be at different cycles there's going to be people so frustrated, annoyed, angry that they're not being listened to at the minute by the doctor. And the one thing I'd say is, get another doctor. I know it's all right saying that if it's expensive or thing, go to another hospital, sign up with an RGP. Do not be afraid just because your mother, your granny. Ireland's very much methodical that, that GP clinic is the doctor and then his father or their sister or their very family. Now, my GP has been great, so I'm not having a go with them because they are a family GP. But this happens a lot. And then because your mum and dad went there, you go there. And that was who delivered our such and such child. And this is who was such a... Don't be afraid to book that trend and say, well, that's okay, but they're not working for me. I'm going to someone else. The thing that is very hard for people to understand, and sometimes that I was fortunate enough, that I could go private for my children, and we got an amazing consultant. But I also could push back because I'm paying for this service. This isn't this. I could push back and ask questions and say, look, listen, I'm paying for this. So this is, like I sent you earlier, that there was a conversation come one time and I was just ignorant of fuck. I didn't care because the number one priority was the woman to my left. So I was like, no, we'll all wait. And made everyone wait for 2 hours. And I was like, it's not me that and that's okay. But in them positions, when someone's not well, they're maybe not physically and mentally. You're completely exhausted. You're in agony. You don't want to rock the boat. You just want help. But maybe sometimes having that other person there to take someone along with you, it doesn't, not a partner or take.
But it did when my uncle came in. When my uncle came in shouting and roaring and my aunt rang, it changed. It changed. And then when I collapsed, I broke my nose, one of my last significant events with my heart. And then I was like, no, I'm done with you now. Because at this stage, I even had to make a will for my son. I'm a single mother. And I knew if something happened to me, where would he go? And I had to go in and do that, in on top of trying to. And imagine when you go in to a solicitor and you make your will and you've nothing on your child. Because that's all I was doing it for. It was just for my son so he could go somewhere. And I remember coming out of there and I sat down on the footpath outside and I thought, at least he's going to be all right. At least he'll go somewhere if something happens to me. And that, no mother should have to do that. No mother. And for me having to do that and to think of that on top of what I've gone through, I don't know. And even to this day I say, please get me to, he's 18 years of age. Once he's 18, and now I'm teaching him stuff because you have to basically teach your kids how to live without you. Isn't that the way we bring them up, really? And I think
I don't
so
know
shocking
whether
for me.
that's because you've had so many encounters with death that have, from a young age, that you feel like it's coming to you at a young age.
Yeah.
And getting that sense from you that you think...
My mother died when she was 50 years of age. She was sick of 40s, and that instills in you for the rest of your life. That stays with you, no matter what.
But at the same time, you're getting the help you need, you're physically healthy, and you're getting back on the track. Is it something you struggle with, the thought of death? And
sometimes it's like with the counselling I'm doing now, I got linked in with the Cry Ireland, so I got the counselling with them after doing the original 3 years. So I'm linked in with them now all the time, but there's a massive fear. I went to the stage of I was waking up in the middle of the night and I was shaking my son because I had an image in my head that he looked dead to me, but he was very much alive. And I knew I was struggling with that again because a lot of the times when I was having the episodes, I would think I was going to die and my son would wake up and find me like that. And that stayed with me for a long time. So it's not as bad as it was because I'm starting to live a bit more carefree. But for a long, long time, I was convinced I would die in my sleep.
And it's understandable. Your quality of life was starting to rescind.
But if I was intervened 2 years previous to that, it wouldn't have gone to the stage of that. If I had been diagnosed with myocarditis like I was 2 years previous to that, it wouldn't have gone to the extent of that. And even for a long time, I was quite happy to stay in bed when I was bedbound because I was eating cake. I was living my best life as far as I was concerned because I was like, no doctor's listening to me. I'm not going into the hospital. It's a waste of time. And you kind of retreat a bit and then my son, every time he came home from school, he'd say, oh, I wish you could play football with me and stuff like that. And then you start fighting back. And I don't think no child should say that, oh, I wish you could do. But then we started, I could do the jigsaw with him. I could sit down. We played Jenga or we played Monopoly. And he'd always start crying because he'd lose every game. But we laughed in that moment. Like, we adapted to how I had to live, but I still wasn't living how I should have lived. And he always used to say to me, I wish you could play football with me, because I was quite an active mother. I was the mother that was in the bouncy castle when the kids party. I was always like that. And I loved being a mother. I love being a mother. I think out of all the things I've done in my life, I thrive being a mother. And that was the biggest part, was guilt. And then one day I was like, that's it. I need to start fighting back. And that's what I did. And I started researching. I actually got sent to London to an autonomic clinic. It was one of the top specialists in the world, as a neurologist. And when I went over to them, I got a lot of testing done. And they did, all the testing was amazing. And I thought, we're a farce in Ireland compared to this. Like, straight away. But you had to get funding, and it took me ages in Ireland. It took me 8 months in Ireland to get this funding to be sent there, because I knew they knew about the other condition I had, which was POT syndrome. They're knowledgeable of it in Ireland, but they hadn't a clue what it was. But when I went over there, the care I had gotten in a week, I didn't get it in 2 years in Ireland. So I knew it was there, but I wasn't getting it. And I ended up doing a rehabilitation program. And every day I went in to do the rehab, I said, you won't see me tomorrow. You won't see me tomorrow. Because the impact of from doing nothing to doing something was so bad. Like, you could go to the gym and in 3 weeks you're fit because you're doing it to get fit. But I was doing it to get healthy and then to get fit. Every single day I told Alan, you won't see me tomorrow. You won't see me tomorrow. And he said, keep going, keep going. And I did keep going every single day, and I absolutely hated it. But I could see my body improving. And I started to get a little bit less breathless, a little bit less fatigue. And I stayed going to it. And then I knew I had to have a target to why I was doing this. Because a lot of people, when you go to the gym or do anything, you give up, don't you? So I decided I'm going to do the Camino. So I signed up for the Camino in Spain.
That's that big?
Yeah.
Oh. So you know the one you said you enjoyed, Debbie's pod?
Yes.
She done like me.
In memory of her son.
Yeah.
Oh, wow. So when I signed up for it, I hadn't a clue what I was signing up for. And I thought it was a bit of walking here and there and off you go. It wasn't the case at all. Oh, I'll never do it again.
Is it like 30 kilometres a day or something?
It was 100. And the second day, the tour guide brought us 16 kilometres in the wrong direction. And imagine...
Oh, they'd have been beat. They'd have been beat left to the side of the road.
That was tough, but I did it every day and I stayed out front. But I didn't stay out front to be finished because I knew if I had waited, I wouldn't finish it. And I came out, and when I finished it, when you walk into the cathedral, something shifts in you. All the shit you've been through in your life, you get really emotional. And I knew if I put my focus into doing this, that I would be so proud. But to do this with a health condition, coming back from what I did, was even more astounding. And for me, my message to people was that even if you're given a diagnosis, you can still live well. And that's what I was trying to achieve. But I'm not saying not doing it, but I wouldn't do it again. It battered my body. Maybe it was too soon. Maybe in a couple of years' time I could do it again. No.
I don't. I think the problem is it's just the physically demanding. People are training for it, and it's absolutely remarkable. And Siobhan, you are a remarkable person because you don't have the hate or anger that I would be filled with.
And I don't want people to feel sorry for me. I'm not doing it for that. I don't
think
that.
they will. There's a resilience in you, and I think a lot of people watching this will be like, I'm not taking that for an answer. And that is, and I know that's the message that you wanted to come here and say, look, no matter your situation, if you're a woman, you're a single parent, whatever it is, be heard, be
believed.
Yeah,
I think that's the biggest thing.
But also, I hope sometimes some of these, and I know they don't set out to do wrong, but after years in something, if your mindset's become get the next one out, take a break from it, take a step back, try and remember that what you can't be bothered doing for a few minutes is having a detrimental effect. The irony of really what's happened here is the people that were supposed to look after your physical health had a very detrimental part to your mental health. And then when you're you're in pain, if they had took care of your physical health, you would have had so much less to deal with in your mental health. You wouldn't have had a year and a half taken away from you. You wouldn't have had, and the guilt of and I know it's not your guilt, and it shouldn't be guilt. It's not, you weren't well, and you were fighting to be back for your son. It wasn't your fault that you're there, but there's a level of mummy guilt when that and I say mummy guilt, and there will be father, but there is that, like, when that wee bond that you, especially Irish mummies and boys, I think there's something. Definitely, I think it's a different level.
But everyone sees me with my son. If I go up the town of where I live now and I'm not with Callum, they're like, where is he? He's always with me. But we are starting to detach a small bit, only slightly bits for me actually going out. But I think we have a rare, unique bond. And that's why I find it so hard that anything that could take me away from him. And I'm so grateful to be here, even though I deserve to be. We all deserve to be here.
I would worry that one thing, and this is we've people that have experienced loss or trauma early in their life have a constant fear of death, and it's very hard to shake it. That
even watching Grey's Anatomy, I can't watch it when it comes to certain things because it shoots straight back to my mother. My mother died really, really the stuff she went through, the stuff we seen was unnatural. Because back then there was no support for cancer. There is now. It's unbelievable, and I've done a lot of fundraising for it. But back then we were told your mother has cancer, and then we seen her deteriorate for years and years afterwards, and there was no support at that time for us. And even at the time, I remember my mother had to go to St. James's Hospital in Dublin. She got the bone marrow transplant. And I remember she was hallucinating and everything. It was crazy. It was like, me and my twin sister had to bath her and everything. Stuff that no child should have to do at that age. And I remember she started to give in as well up there. And I had said to her one day, I says, come on, we got to get up. And she got up and went out to the front door. And the breeze in her face. Again, nobody will understand that when you're inside for a year and a half. And then you come outside and that breeze hits your face. And it gives you a bit of hope. And I remember my mother was an absolute fighter. She was very loud in what she wanted as well. And I think she suffered an awful lot as well. A lot of it needlessly as well. I remember as well, my mother brought her into A&E another day and trying to explain to the doctors that she was dying at this stage. And she was still left out in A&E with everyone else. And I remember my dad kept going up saying, like, she's not well. And until my mother actually started projectile vomiting blood again, that she was rushed in straight away. But it had to get to that extent before she was brought in. So I think it's quite cruel what we had to witness even as kids. And it does shape you because
you can't not.
Like, there's a lot of kids that have happy childhoods and they don't have a clue of what I'm talking about. And then there was a thing with Callum, was like, is Callum going to go through what I went through? And I think that was really hard for me to sit with, because it wasn't my fault or it wasn't my choice to be like that. But there's still that trauma from childhood of what we witnessed. And is Callum going to be witnessing this? But I intervened very quickly with Callum and I got him play therapy last year. And he stayed going. And the lady said, he's fine. He's actually really, really well. But for him, you have to come down to their level as well. Like, this was a 6-year-old boy that had to ring an ambulance for a mother. And then now at 8, he sees his mother doing well and he's starting to settle. But I felt that I had to come down to his age group and see what he could see through his eyes. And he is doing really well. He's a very, very happy kid.
Oh, man, about there, he's a happy boy.
Yeah, and he's wearing 2 casts in his legs. Like, again,
the heads keep coming. Was it the operation for his feet, did you say?
No, so this is another thing. I had to advocate for Callum as well, because Callum was tiptoe walking and they said he had short Achilles and he's quite tall for his age. So even though I was sick, I still had to make sure that this boy was looked after. And basically, he's up on his tippy toes because it was more comfortable for him when he was in severe pain. And basically, that now have both of his legs in casts to see can they ground him and hopefully avoid surgery.
But it's to keep it in that place, isn't it? The stretches, Achilles, effectively.
The first 2 nights he was crying a lot, but now he just gets on with life as well. He's so resilient as well. But again, he had to be screened as well through cardiology, and he had to wear all those heart monitors, stress tests, and stuff like that. And
can this be hereditary or
it could have been? That was the road that it was going down because of the family history. But it did turn out that he had an overactive sinus node, and this could have been from COVID as well. So when he runs now, he has to sit down. He's allowed to go back playing sports now, but that was taken away from him as well. And then the impact of that, of knowing that he's struggling with breathlessness, and I got a call from the school to say my son was breathless, and I knew straight away what it was and got him tested. But then again, when you go to Galway Hospital, you're told you have to wait 9 months to get these tests done. And as a mother that was in the middle of this, imagine having been told you have to wait 9 months to get these tests. So I ended up bringing him to Dublin and he got seen within 3 weeks. But even for that, as a child,
but you're having to do this.
Yeah,
you're having to fight, and this is what I'm saying. Like, what advice would you give to not just women but men that are frustrated and are so much of what you've said resonating? They feel like they're getting turned away and they're starting to question. And you would question your own sanity. There had to be a point where they were giving you drugs where you're like, shit, is it all this happened to me?
I did, because I came out of the hospital one day. There were 6 doctors around me, and every single doctor thought I was absolutely bonkers. And I thought, I'm not even going to bother trying to convince them any different, because they had their own opinion of me. So I left. But it was actually, I didn't leave straight away. A nurse came back to me and she tipped me and she says, Siobhan, ring Cree. She says, I'm really, really sorry how they, she's seen how they treated me.
This is what that Spanish doctor said, the humane people, the people that want to help.
Yeah. And she sat in the bed and she gave me a number of Cree, and this is the Heart Foundation down in the West. And they've been phenomenal to me, and only for them being linked into their nurse.
We'll include their links and for people here. In
but only for them. They allowed me to speak my mind. I felt very safe. I felt very heard. And that made all the difference. And for them, I'm extremely grateful. Even Cry Ireland, when I got linked into them first, by that cardiologist sitting down, listening to my symptoms, she gave me a cardiac MRI. Why wasn't I given it a year and a half before? I don't know. I'll never know.
And you know what? Like, well, thankfully you got it.
Yeah.
There's so many people that just accept what was said to them. We had Lynn, a fantastic woman, on here. She had breast cancer. She had a BRCA gene. She had to fight to get tested for the BRCA gene. Like, she had to fight tooth and nail. She actually got. She was told there's nothing they could do for her. Then she was like, no, that's not good enough. I went to our doctor, and she says to me, she sat there and she looked me in the eye and she goes, if it hadn't have been for I just wouldn't take that doctor's at the thing. She goes, I would not be here now.
Yeah.
And like, how many people's not here now because they haven't because you just assume you're in the best care and the best people are dealing, but that's not always the case. But you know how much of a better person you are than me. Do you know, you ever see the scene in Good Will Hunting where he gets the phone number and he walks up and he slams it on the window and then he just gives your boy the finger? How do you like them apples? I would have literally, when I got diagnosed with it, went back to the cardiologist, slapped it again in the window and go, fuck you.
Do you know what? So many people have said that to me. And at the time, I wrote out a really, and you can say things really, really fast and in the anger. And then where would it get you? Absolutely nowhere. I hope that she sees me in my interviews and stuff like that. And she quietly thinks to herself, I'm going to do better for the next person. By me sending her an angry email, I don't think it would have benefited me in the long run at all. I don't think she would have even changed her opinion.
I'd have got a good old short term.
Yeah.
But this is why I'm saying you're an amazing person. I've really, really enjoyed.
I've been angry, but I don't think it gets you anywhere. I really don't.
No, and sometimes anger clouds the truth of what you want to say. If you say something angrily or out of that aggression, where it's easier to listen to somebody when they're talking sense or they're talking in a calm tone of rational. They're rational as opposed to being irrational and angry about it, where you had every right. And let's face it, you had every right. That doctor, Callum, I'm a thick boy, like, so I would probably have been back there later on that evening after I would have dropped you down.
But I hadn't time. I had too many things to fight for.
You didn't, and you're right, and you done the right thing, and sometimes that's what I'm saying. Even being hot-headed like that, it's not the right thing, and you're right. And being here, I have no doubt you've helped people. I have thoroughly enjoyed having you here. You've been through so much tragedy, but there's a warmth to you, and there's the love you have for Callum's amazing. And actually, when you start talking, I was like, Jesus, that woman needs to move on because I'm going to start tearing up here. It's amazing, and it really is when you said it at the miracle, because the chances you had of conceiving him, and they're saying 4%, so basically it's not much of a percent, and just because you've conceived, endometriosis can make it a very hostile environment to continue on your pregnancy. So and you had such a bad pregnancy and all the things that have happened and your friend and all them things, but to be here now. I hope
it's the end of it, though. I really hope from now on I can really start living my life well, and I really hope. I hope,
and I hope that you're going to help a lot of people, and you might not realize the difference you could make in someone's life, because they might be somewhere down the line that they wouldn't be because they didn't listen to you, they didn't hear that, and they didn't hear that message. They might be that person, they might be that Lynn that says, no, you know what, I've seen this before, and I heard a woman talking about this before. There's other things, and you know what, if you get a second or third opinion and they're the same as the first opinion, at least you've confirmed it 2 or 3 times.
Yeah.
Do you know what I mean?
But why do you care if you're not a doctor? At least your family are not left with the aftermath of the effects of you dying or being misdiagnosed or something like that.
Yeah.
And I think that's the biggest thing, is advocate for yourself and listen to your body. So many people die suddenly, but there's a big chance that they had symptoms that I ignored or a doctor ignores. I fully believe that. And I think for the rest of my life, I will live very differently. I will not care about the small stuff. I will be loud and proud, and I think live for the moment. I'm going to Aviva Friday. I've never been to a match because I hated being in big crowds and stuff like that. And I'm really excited to start living my life with my son. We've travelled a good bit this year but then there's an other side of it. Do you know when you nearly die and you think you're going to die? There's this feeling of you have to live your life like as quickly and do everything as much as you can, and that's exhausting as well. But I have calmed down a bit now, where I'm starting to enjoy the things, and I don't feel like I have to do everything all at once to come back from. Do you know what I mean?
Yeah.
When you think your life is over, then you think you have to do everything at once. But I am starting to settle down now and starting to enjoy life again. So, but I am doing hyperbaric oxygen treatment. Have you heard of that?
No.
So basically, what I'm left with now is still a little bit of breathlessness. The fatigue is really, really bad still. And the venous pooling in my legs. Because I was bedbound for so long, I lost the muscles in my legs. So when I stand up now, my feet turn purple. So it's still a bit debilitating, but it's my new norm, so I try and get on with it. So I started about 20 sessions ago doing hyperbaric oxygen treatment, which is 100% oxygen in a compressed chamber.
Yeah.
And I really started to enjoy that. But again, nobody here in Ireland said, go and do it. It'll help you avoid all the medication and stuff like that. The first 10 sessions, I didn't enjoy it because I felt like it was really exhausting on top of what I was already going through. But I'm really, really starting to see the light at the end of the tunnel from trying something different. And I'm really starting to see the benefits. I'm off all my medication now for the first time in 3 years, which is phenomenal, because when you're given them, you don't know. Nobody tells you when it's going to be the end of it. But from the rehabilitation from London, swimming, I do a lot of swimming, walking. Everybody should be walking, because at the end of the day, you've only one heart, and that heart is a muscle, and you need that muscle to be strong for the rest of your life. So we did a heart-to-heart and an event in Galway for the Heart Fest, and I got to speak to hundreds of people. And I'm not a medical profession, but I have experience in what I've been through, and loads of people thought breathlessness and fatigue was from being overweight. There was like a tick a box. And it's largely got to do with your heart as well. And then there was a questionnaire, and none of them did any exercising. And I was quite shocked by that, because a lot of them were bus drivers or workers. But a lot of them were men that came, would you believe? And I was like, this is amazing. But they didn't move. They didn't do any exercise. And even the two men had promised me.
Did they fall into a vicious circle there?
Probably, yeah. They were quite happy.
If you're breathless and doing nothing, do they start doing something? Do you know what I mean? How do they get to the point
you can get deconditioned as well and make you breathless and being overweight?
Yeah. No. But you know what I mean. If you're in that circle, like you want to exercise, but you've let yourself come back that far that it's nearly.
It's a big challenge to come
at the
back
start of
from
the
that.
year. Like, I was so much more overweight. I'm still overweight and I'm still working out now, but I'm training now. But I remember when I first went to go back, the pain, the legs, the shin splints, was just the sheer weight. But then it becomes a vicious circle. You're like, you're going to have to keep doing this, because it's going to be sore. It's going to get
up
worse.
Against what your body is telling you not to do, really, isn't it? But were you breathless starting?
But this is the thing. I was breathless because, and for sheer just overweight, and not what you had to endure, and not what them people have to endure that if with that condition. So like that's why I wonder so much, like, do you have somebody that is specialist in that, like a trainer that would say to you, look, I want you to go to you at this point, or is there people that give you guidelines on that there, you know?
With me, I was given a program, and I went to the swimming, but they did.
Was this from London?
From London, yeah. They gave me a full program.
But you fought to get this. You had to first load the knowledge of what it was and how to deal with it, and then resource where to go, then resource the funding. But, you know, people out there, hopefully then they're listening, they're like, there is somewhere else, and there is an alternative. And we're very funny here. We think we're the elite healthcare, and I know we're Northern Ireland, South Ireland, but what I mean is, in here we think we're in the Western, or you know, we're in the elite healthcare. And I have went out to Spain and seen the level of healthcare out there.
They're really good.
Oh, amazing!
If you ever want to get sick, go to Spain. That's what I always say.
Amazing. I've seen people. I actually was talking to a friend, and they were Polish, and I was working with them in Spain, and they had a problem with their back, and they're like, "Oh, I'm flying back. The doctors there are amazing compared to what I can get." And we just have this narrow-minded view that we are and it's very much not. There's alternatives out there, and there's people.
I think we can't get sick in Ireland. I just think it's too hard. It's too hard to have to fight your way back from it. But I got an occupational therapist, a social worker, and a physiotherapist. But I didn't get that till 2 years after I got sick, and I had to get a stair rail, shower stools. All this was put into my house to help me live independently at home. That's how bad I got. And still imagine being that bad and not being listening to. Yeah.
And a wee boy in the middle.
And then we got an alarm in the house. Do you know, you see a lot of the elderly people with the alarms, and you press the button and this medical services come. But that gave my son great confidence. So we could press the button, and within seconds somebody spoke through the speaker. So if I did get sick or collapse or anything like that again, my son knew that if he pressed this button, within seconds somebody could speak to him. But for me it was great because I could stay living at home independently. And these services were not told in the hospital. They were told by other like TDs in the area and stuff like that helped, that came in and seen how bad I got.
But you had to...
Nobody handed it to me. Nobody handed me nothing. Even to go on disability. I worked very hard all my life. And when I was faced in this, I had no work. I couldn't work. And then I had to fight. I had to prove that I was going to be disabled for another year before I was given the money that they were giving me. And I had to contact 2 TDs. They really fought my case, and within a couple of days I had received it. So there was always a challenge that I had to deal with. And then even trying to get appointments. I found the secretary so stressful. Oh man, I think that was the biggest battle.
Podcast one time on, and then I called out all the doctor surgery or secretaries, and then I remember one time phoning mine after, and I was like, but they're a different breed, like. I
actually unfortunately left my GP. My son stayed there because my GP was fantastic. He was so good. He was so kind. My son stayed there, but I left because one day I was sitting down in the chair. I could turn. I had vertigo. It was just part of the autonomic system, the way my body had gone. And I had sat outside after my appointment, and this secretary came to me twice. And she says, "Why are you sitting there?" And I was like, "I'm not doing anything wrong, just let me sit." Because I was quite embarrassing as well when she came forward to me. She came to me a second time, and at the second time the GP has come out and he goes, "Just leave her there, she's fine." But what business was it of hers? Another time I went in, my heart was absolutely racing. And I managed to drive down to the doctor's surgery. And at the time it was COVID, remember we were in the mass. Yeah. I walked in, I burst in the doors. My heart was doing 180 beats per minute. Nobody was going stopping me. So I went up to the secretary and she says, "Where's your mask?" I said, "Are you joking me?" I said, "My heart is pounding. I'm literally going to die here. Where's your mask?" And I had said to her, she goes, "I'm actually going to die before you help me." So I burst past her and I walked in the GP and I opened the door. And he said, "Siobhan, I'm with a patient." I was like, my heart is racing. But at that time, it was just the care of like, they knew I was a frequent flyer at this stage. You can't tell when you're going to get a high heart rate. And I remember going in that day, and when I came back the next day, and I was kind of embarrassed because I had burst into this GP while he was seeing a patient. I was like, my heart is racing, but he did get me in, and I ended up in an ambulance and off into Galway. I went into the hospital. But I remember thinking, like, I don't want to be here looking at you. I don't want to be like here.
Do you ever see the memes of them? "Thou shall not pass."
But it shouldn't be the way. And I know they have a hard job, but it's all got to do with who you meet.
A lot of actually what was said back to me at the time was like, I remember because like my GP's retired now. He's a great fellow, but I remember one time he's like, "Oh, and you don't realise what they have to put up with, people phoning up the 10th day in a row. And I made up another thing. And
yeah. And but at that stage, I was a frequent flyer for this condition. There should have been a small bit of...
Well, on the other side, so what actually happened was then I remember, this is how this changes. So like, if they had knew it was you, this, you know, why wouldn't they go into a different gear and be like, "This woman's not well. Okay." I remember I hadn't been to my doctors in like 10 years. So I had to like sign back on or something, you know, like re-register or whatever it was. But anyway, I was getting these severe migraines, and then one night my nose started bleeding. I started being sick, and the pain in my head. So I phoned up the next day, and I was like, oh, can I get an appointment? No, I can't get an appointment. It was all the same shit. You can't get an appointment, blah, 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 blah. And then I said, look, can I speak to the doctor? And they were like, phone. So one of the doctors rang me back, and so there was like two doctors when I first started going out practice. There was two doctors, so one of them phoned me back, and she was like talking away to me and like completely normal. She's like, what happened? I was telling her something, blah, 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 blah. And then the next thing she just literally tone changed. She was like, ring me back. I want you to go straight to, was it Causeway or something, for you're booked in for a scan later on, blah, blah, blah. And I was like, well, what's happened? She goes, if you haven't come here in 8 years and you're complaining about something, I want to get that checked straight away. They change.
Yeah.
So I get what you're saying. Like, be annoying to the annoying people.
Yeah.
You know, be like that. But if they know that you're ill and they know that you're experiencing this,
I shouldn't have had to have left because of that situation with that.
Right.
Yeah, because the GP was fantastic, and I'd never say otherwise. So it's a shame. It's a shame, and it's all about who you come in contact with. It really is. I don't care what profession you have. I think it's your ability to have empathy and to listen to a situation.
Nurse that come to you, you know, they go on to cry and cry, and then people that instantly, like, surely your mind was like, when you spoke and you knew they were listening to you, it's bound to have just been like, oh, a breath of fresh air. Somebody is actually listening to me now, and they understand, and now there's maybe a bit of light. Like it, you know, and you know, that's all you're asking for, was to be treated with some common courtesy, decency. Listen to what you had to say and take that on board. Not what they thought of you. They assumed they assumed your life was this, and they assumed this is what you want. Like prescribing you antipsychotic, putting that in your notes, like painting a picture of you that's not true for every other appointment and doctor then that you're to go to. Like it's been weird, this pod, because I've actually really enjoyed, because there's like a warmth and a strength in you, which I am glad that we're doing the pod to help people. You've had so much tragedy, like I'm not glossing over that, and I know that you have some way to go, and you know, with that, your health, you're back to where is a comfortable life. It's the quality of life we're talking about. I know that you're still you're endo and dealing with that, and it's almost like that has been pushed back, which is so severe.
I haven't time to deal with that, because I had to put into play the heart condition and stuff like that.
But it's almost like, you know, and people that are suffering that will be like, oh my God, I can't imagine throwing this, that, and all else in the mix. So I just hope for you that, you know, we're on the track now. You're getting the right treatment, and, you know, it's weird for me to say that. I hope you get what you want in like, saying to a 38-year-old woman, I hope you get, the doctors aren't questioning your sanity for your reasoning, your why, you know, that they'll take you and listen to you, and you say, look, I am done here. This is what I want, as opposed to telling you what you should want. It's a weird thing that I understand why they would be like, look, we don't like to do irreversible things when there's other. We've exhausted alternatives. We've been down roads. We've done medications. You know, it's a pharma after pharma. If there was a tablet that would work, you'd be like, boom, sign me up. I'm good to go.
Let me go home and live my life,
But, you know, we're finishing up. What would you like to say to anyone that's at different stages?
Well, a lot of the time I felt very much alone, because you are alone to deal with these circumstances. Like, nobody can help you really get through being from bedbound to living your life well, only yourself. You can have a lot of supports, but initially it's yourself that has to do it. But for me, I wish I had the courage to pick up the phone sooner and ring people about my condition and to get support that way. I spent a lot of time alone, and I think that made it a lot harder. And link in with your services. All these services are there. There's Cancer Care West, there's Cancer Research, there's CRE, there's CRY. All these, they're all there to help you. And like recently, a friend of mine went through cancer, and they didn't pick up the phone once, but they really struggled. But I couldn't understand that, why there's services there. But people might not be ready to do that either. But there's a lot of services available. And I think even if you're dealing with mental health, living with a chronic condition, with anything, just go find your people. There's people for every sort of condition, and there's always somebody else suffering the same condition as you, and find those people.
Was there forums online that you'd said you linked in? Did that help speaking to people with the same?
Yeah, there's an Endometriosis Ireland, but then sometimes it can kind of delve into the negative side of it, and that's what I found as well. So I had to pull back a bit from it, but I found more so contacting to a counsellor, like with Peta House, with all those suicide or hearts foundations. They all have counselling that deal with specifically that condition, and I think even going forward, I really want to help out with Cree, because they've given me a lot back and they made me feel safe, and I trust them. I really trust them. And for me going forward, to be able to advocate for women, and so for me going forward, advocate for yourself. And I hope from this, anyone that's ever felt alone in the last couple of years, that from me, you have a friend and that you're not alone anymore. And I think the biggest part of that was to not feel so alone when you're going through what you're going through. Definitely advocate for yourself and live your life. Take the trips. Do anything you want to do. Don't put it off. That's what I do now. My uncle just rang me and I could be out in the lake kayaking. The next day I could be up in a mountain. And he just said, I'm on a journey, and he's going to let me off on my journey, because it's very different. You live very different when you've been through what I've been through, and the little stuff. And even if you fall out with friends or you fall out with family, it'll come back around. It really does. But don't get too stuck into it at the moment. Things come back around. And I think, I don't know, just laugh and smile. That's been taken away from me a lot. And I try and do it now. When I didn't smile or laugh in a long time, when I heard myself laughing the last couple of months, it really, really warmed my heart knowing that it came back. I don't know. I'm sad. Yeah, I think there's so much sadness around what people go through. I think life is very sad. Like, there's so many people that get up every day and have to deal with stuff. And I think if you find some balance in that, or live your new norm and find some peace in that, it does help. It really does. But there's an awful lot of pain and suffering. And I don't know. Just live your life well. That's the way I am trying to do it anymore. And even when I was coming up here, I was so excited, and my son was like, I want to go to the Titanic. And I was like, we'll go to the Titanic. And he had the best day, and he's 2 casts on him. We got a wheelchair, and it was fine. It wasn't the way we would have wanted to have done it, but we made it our day. And all the staff were so lovely. And it was so lovely to sit. I find that even sitting, talking to people now and telling your story, they'll tell you your story back. So tell your story. Even if you feel like you're a burden, just tell your story. The amount of stories I've heard in the last year, some of them are heartbreaking, but some of them are just so lovely as well. And I think give people your time. I go into my neighbour, she's 96, and I could sit and do a jigsaw with her for 10 minutes. And then I go off the rest of the day. And I do that because I know what it's like to feel alone, even though you're elderly, whatever age you are. For somebody to spend that time with you, even Christmas is coming up now. I don't want gifts. You don't want anything. You want to spend time with somebody. That's what's important, not all this big extravagant stuff. Do you know what I mean? Spend time with people and listen to them. And I think that's what I would want going forward. Spend time with somebody. Go and do things.
That was an amazing way to finish up. Thank you so much, Yvonne.
Thank you for having me.
No problem.
Bye.